going to try to get him to come over here to the microphone, and people will let him go. We need to keep this aisle over here clear at the request of the fire department, so if you please could keep that in mind. And those folks standing over here on this side, and maybe you could stand on the other side, that would be much appreciated. That's the request of the fire department. We greatly appreciate them hosting this evening, so we want to be able to come back and host you all again. I'm going to invite the supervisor up here to lead us in the Pledge of Allegiance. Supervisor Josh Ostrander, thank you.
Thank you all for coming. As the town supervisor of Kiantone, I'd like to thank Senator Borrello for having this event here, and we appreciate your attendance. The flag is in the back of the room. Everyone can face the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And before I have George come up, I just want to make one other comment. We understand there's a lot of people here tonight with a lot of concerns. We're going to try to address as many of them as possible. If we don't address your concern this evening, we have myself you can talk to, Lisa, who works out of our Jamestown office, and Randy. Randy's somewhere in here as well. I will make sure. Oh, Randy Holcomb, I don't know where he went, but he is in here as well. He's outside. When he comes back in, you can harass him as well if you need to make sure that you get your question addressed. But without further ado, we'll have our senator come up.
Thank you. Thank you.
All right, thank you all. Good night. We'll see you. Thank you all for being here. First of all, when you do events like this, normally it's 10, 12 people. To see a room filled with people that have questions and concerns about their government and how they're being treated, I'm glad to have you all here. Thank you all very much for being here. I have two very special guests with me tonight. We have my partner in Albany and our Assemblyman, Andy Goodell. And someone I've worked with for many years in the legislature and our county executive, PJ Wendell. And we have, and how about a thank you for Josh and everybody here at the Fire Hall for letting us be here tonight. Thank you very much. And I just want to say before we get started, I'm going to let my colleagues here kind of start off and talk a little bit, but we're here tonight speaking freely, number one, because of our Constitution. But more importantly, we're here because of the people that have shed their blood for this nation. So thank you to all of them. To our first responders, all those people that wake up every morning, don't know if they're going to come back to their families, thanks to those people also. So with that, I will kick it over to our Assemblyman from the 150th Assembly District, the last Assembly District. It's the furthest away from Albany, and that's Andy Goodell. Andy.
Good evening, everybody, and thank you for being here. George is right, Senator Borrello is right. I represent the 150th Assembly District, which means that we are the furthest you can get from Albany and still be in the same state, and I like it that way. And that applies both philosophically and practically. And this year we've seen a very far left group of new legislators coming out of New York City, and they've really changed the dynamics in Albany. And I will tell you that there were a number of very well-respected, moderate Democrats that lost in the last election. And you've seen it in a number of legislative initiatives, and we'll talk about them, I'm sure, today, including, for example, in the budget. They raised taxes by several billion, and included was $2.3 billion for illegal immigrants. And unlike any of the federal stimulus or the federal unemployment, it was a flat dollar amount. So if you could prove that you were working in New York illegally, you got $15,600. And if you couldn't prove that you were working at all, you got a consolation prize of $3,600. Now we've seen a number of legislative initiatives dealing with law enforcement and crime. So a few years ago, the legislature passed catch and release, eliminated bail for everything except the most serious crimes. Over 400 crimes now no longer have bail. And that was followed up by the Defund the Police initiative. And the lieutenant governor that was just appointed by our current governor led the effort to defund the police in New York City. The governor just recently, with a big smile, signed legislation that's called Less is More, and what it did is it eliminated parole as a practical matter and said, if you're out on parole, the only reason you can be violated is if you commit another crime that would put you back in jail anyway. And it's properly named Less is More, because we're going to have less supervision and more crime. All of you have been painfully aware of what's going on with COVID. I am so thankful that we have a county executive who understands the medical issues, has a background as an EMT for years and years and years, and has taken this issue on straight up. Thank you, PJ, for what you've done today. And on the state level, my colleague, George Borrello, has been leading the fight to restore sanity when it comes to vaccine mandates and mask mandates. George, thanks for all what you're doing. So, without further ado,
Sir, can we have him speak? Okay. I'm just curious.
So we have another member who wants to have the mic, and you'll have an opportunity in a minute. But
Yeah,
let's turn it over for some opening comments to PJ Wendell, our county executive. Thank you, PJ.
Thank you. You know, many of you, I know many of you in here. Some of you back, Rick and Joyce, that I worked from my ER days. So, yeah, I've got a tremendous amount of experience. I've been in the EMT for 26 years. I've been in the fire service 33 years. One of the most, I don't know, unique conversations or points that, as I have an opponent put out, it says, your county executive is failing as a politician. Great. I'm not a politician. I'm here to run county government. I'm here to stand up for what we believe in. That's not what I do. A little bit about me. You know, Andy and I were on a phone call yesterday, and it was on the mandates and the healthcare crisis we now have. And I spoke 2 weeks ago. I reached out to NISAC and said, we need something. My county is going to be in a crisis. Saturday morning, I was on the phone with Tim Richards, who's right in the governor's office. I have a direct line. I speak. These concerns that you are hearing, these concerns you share, are shared and echoed right back to the executive chamber. Tuesday morning at 9 o'clock, the county executives, there's 18 of us, have a meeting with the governor. A meeting we've been asking for nearly a month now, and we're finally getting it. Bipartisanly across the state, we all agree. What she is doing is creating an unnecessary health crisis. I support those who make that choice. If teachers, which I've done for 25 years, have an ability to test out, why not our healthcare workers? We've asked this bipartisanly. I made this statement. 2 assemblymen from Buffalo, and I believe our congressman, Chris Jacobs, right, echoed the same thing. Why don't we allow this? The question we're asking now is, if our health centers, UPMC Chautauqua, or Brooks, or Westfield, needs help with their dietary staff, or their cleaning staff, or their billing staff, will they get help from the state government? Because all we're hearing is they're going to send the National Guard, and I guarantee you National Guard does not have cleaners, they don't have dietary help, nor do they have billers. So we are mandating all of these people to be vaccinated, yet they don't have direct care with patients. Well, but if they deal with somebody who has direct care, that's not the same, okay? It's not. It's proven you can get COVID if you're fully vaccinated. The questions haven't here. Brian Walters from our medical staff. You need to ask the question, where is the information that our healthcare workers in the hospitals are spreading COVID? Because they're not, okay? These are the questions we are going to be asking the governor. Andy and I asked them yesterday, and they could have said, we want to tell you the story, but it was like reading from a script. They couldn't answer the questions. They could not answer our questions. I can tell you this, I'm going to continue to fight for this. We're going to continue to push the governor. You know, what you saw was her declaring a state of emergency, which is something county executives were going to unite and do. Forcing the state's hand to make, now she realizes this is a crisis, okay? But the problem is, we need help. The crisis can be averted. I don't care if you're Suffolk County and Chautauqua County, 532 miles apart, we're still in the same state. But we have the same concerns. We are going to air those. I don't know of anybody in our group of the 18 county executives that are opposed to, or actually are in favor of what the governor's doing, because this is creating an undue stress across the state. So again, what I can tell you is I'm going to continue to do this. I'm going to continue to stand up. I didn't realize this until I went to a recent conference. Old guys, it was known my position is to stand up to the governor, stand up for the people I represent. That cannot be questioned, especially by my colleagues. You know, so for what it's worth, I'm going to continue to fight for you. I'm going to continue to go to the governor, and we're going to continue to do what's right, not what's imposed. I said it on a...
But I just want to do a kind of a quick intro and talk a little bit about what has been going on in Albany and with our state government. You know, I don't think there's very few people in this state that was sad to see Andrew Cuomo leave the position. So, yeah, Republicans, Democrats, I think we can all agree on that. So this is a man that abused his power and covered up nursing home deaths. He was, you know, a dictator, an absolute dictator. Yes, and I am sad to say that unfortunately the leadership in the assembly decided to stop their investigation. I think that's wrong. I think he needs his day for people to understand exactly what happened, for him to be held accountable for his actions. And I hope that day still comes. Yes, sir. You know, I sit on the aging committee, and you know, I see a lot of my colleagues go down to New York City, and they get in front of their cameras and say how horrible the governor was and all this. But when it came to Albany and where we do the job, we introduced three times in the aging committee a motion to have Dr. Zucker, the head of the health department, and Melissa DeRosa, his number 2, come and testify in front of the aging committee about exactly what happened in nursing homes, exactly what did they know and when did they know it. And every time, unfortunately, every Democrat on the committee voted no. I'm sad to hear that, because these are the same people that said we should hold him accountable. Accountability doesn't happen on Facebook and Twitter in front of TV. Accountability happens in Albany, where you do your job. You know, we've had a lot of serious issues as a result of this pandemic, but the thing that probably has come to my mind the most is the whole idea of never let a crisis go to waste. And that's, you know, that was a Saul Alinsky Rules for Radicals answer to how we, you know, push an agenda that isn't generally going to be popular with the average person, and that's to, you know, take advantage of a situation like this. And I absolutely believe that this pandemic has been used to advance an agenda and to strip us of our rights. That's absolutely correct. But you know, there are a lot of other issues that are facing us as well, and I want to talk a little bit about some of these issues. You know, New York State, in a short period of time, has gone from being one of the safer states in the nation to one of the most dangerous. You know, not even 2 years ago, New York City was the safest large city in the world. Now New York City is one of the most violent places in the world. Sadly, that's the case in a short period of time. This is because of bad decisions made in Albany. our bail reform laws, so-called bail reform justice, criminal justice reform laws. We saw an immediate spike in violent crime, pretty much every category. So they can try and spin that any way they want, but that's the reality. It's reality versus rhetoric. And the problem is that when they craft laws in Albany, you know, it's not like, you know, when I was in the county legislature and county executive, you listen to all sides, you take in the information, and you do the best job you can to craft a responsible piece of legislation. That's not what happens in Albany. What happens is they have special interest groups that feed them the lines that they want, and they don't listen to the other side. And that's exactly what happened with our criminal justice reforms. They didn't listen to district attorneys, the victims' rights advocates, the people that work with people that have substance use disorders. They didn't listen to any of those folks. They didn't listen. They didn't want to listen to them. They listened to the people that told them that this is what we want, and that's what we got. We got a series of laws that made New York one of the most dangerous places in America in a very, very short period of time. And that's the unfortunate part of this. Good leadership is about building consensus and understanding the positions of all sides. It's about moderation. It's about ensuring that what you're doing doesn't have unintended consequences. Although sometimes, I'm not sure if they're unintended. You know, we had our new governor release people from Rikers Island. Now you may have an issue with Rikers Island, but where was the due process? Where was the idea of taking this person in front of a judge and ensuring that they're not a danger to themselves and others? No, we just released those people. That's the kind of thing you see in a third world country, right? Where they open up the prisons and let the prisoners out. That's what they do in third world banana republics to overthrow a government. That's not what we do in the United States of America. I don't care what you are, liberal, conservative, Republican, Democrat, not affiliated at all. You should be concerned about how your government operates. Yes, sir. And that is really one of the big issues. We have a lot of issues that affect us here locally that myself and Andy and the county executive worked on. Broadband is a big issue here in our area. You know, our previous governor said, thank you, our previous governor said that we have 98% broadband coverage in New York State. He said that several times, and unless the entire 2% is right here, it's not true. The reality is it's about 60%, and we've been pushing hard to bring more broadband to this area. We actually had a big success in finding what was called a piece of dark fiber, which is a piece of underutilized fiber optic that was actually run over a decade ago that runs about 100 miles through Chautauqua, Cattaraugus, and Allegheny counties. And we were able to locate it, find the company that's now actually in charge of it, because it was built with government money, and get them to agree that they're going to help us fast track more broadband throughout this area. So, you know, on the downside, we had a very damaging law that was passed that taxes fiber optic cable by the foot. It was passed in 2019 and went into effect in 2020. It actually, there's the tax on that fiber optic cable to run through New York State Department of Transportation rights of way is actually more than what it cost to run the cable. And it's killing a lot of projects. It has killed a lot of projects, scaled back a lot of projects. We've introduced legislation to Andy and I to pull that back. It should be rolled back. We've seen a huge spike in the costs, which have resulted in less and less people getting broadband in their homes. We did have a success this year, a bipartisan bill that I co-sponsored that stopped utility companies from price gouging accessing their poles. They went, thank you, anybody knows that what I'm talking about. It used to be about $2,500 a pole if you had to run fiber, and once these utility companies saw all the federal and state money going around, the cost went up to $10,000, $12,000 a pole, sometimes more than that. So they were gouging, and they'll disagree with me, the utility companies, but the reality is they were gouging, and again, it slowed down and scaled back a lot of projects. We passed a law this year, we're waiting for the governor to sign it, that fixes the price, that they can no longer price gouge, and we can hopefully get more broadband faster. So we'll hopefully move it. There's a lot of other topics we can discuss. I do want to mention the legalization of recreational marijuana. Again, this is one of those topics, if you're for it or against it, you should be upset with how it is being rolled out. You know, here in New York State, they passed a law in March And here we are 6 months, almost 7 months later, and there's no infrastructure in place. They've basically done nothing. They've appointed a couple of people that we confirmed, in that gap, that vacuum of information has been filled with misinformation and fraud. And that's the problem that I have with it. If you're going to do this, you should do it right. First of all, we passed a bill that if anybody believes there's going to be any true revenue from this, you're sadly mistaken, because we passed a bill that, number one, we've already decriminalized marijuana, and that if you like that, that's great. The problem is that it is strengthening the black market. We've also passed a bill that says that any person can have up to 5 pounds of marijuana in their possession. They can grow their own plants in their home. And again, you might think that's great, but from a revenue standpoint, there's not going to be any revenue, because there's no way to tell the difference between legal marijuana and illegal marijuana, right? So if you're going to expect to have big revenue because you're selling legal marijuana in a dispensary, when anybody can grow it and have 5 pounds of it at any given time in their possession, any adult in the house. So if you have 3 adults over 21, you can have 15 pounds of marijuana in your house at any given time that you grew yourself. Where's the revenue going to come from? I'm just giving the practical facts here. The practical facts is there's not going to be any revenue from this. So, and now I'm trying to do my best I can to make sure that this is done responsibly. It's going to happen. I know the majority of New Yorkers want it to happen. It's not happening the right way. And the reason is we had an opportunity in New York State. We had an opportunity, because we were the 15th state to do this, to say, let's look at what the other states had done wrong, and let's not do that. We had an opportunity to say, we have the history, in some cases more than a decade, to see what has happened in other states and craft a responsible piece of legislation. I tried to actually make that happen. I gave a lot of advice, if you will, to the people that were crafting the bill, saying, here's the things you really need to do to ensure we're doing this right, so that we're addressing public safety issues, addiction issues, everything else that needs to happen. Public safety being number one. That was all ignored, because the philosophy was, how can we prove that we were the most progressive state in the nation? So whatever every other state did, we have to do that much, I guess, further to the left, for lack of a better term. And that's the bill that we have now. That's the problem. New York State has done what no other state has done, and that is to allow anyone to consume marijuana literally anywhere. The only restriction is that you can't smoke it in places that restrict smoking. That's the only rule. And keep in mind that states like Colorado, I think roughly 70% of the marijuana that's sold there is not for smoking. It's for consuming with edibles and so forth. So imagine the public issues we're going to have. Again, you can't walk down the street drinking a bottle of vodka. That's illegal. But you can walk down the street and you can consume marijuana. You can't walk into a restaurant, a licensed establishment, with your own 6-pack of beer and sit there and start drinking the beer. It's illegal. You can't do that in New York State. But you can come in and consume marijuana. No one's really going to know if you. And then those people, those operators, are now responsible for your level of intoxication. And that's the real issue. We didn't craft a responsible law. We crafted a law that's supposed to look like New York is the most progressive. That's a stupid contest to try to win. We're talking about the public safety and public health. So that's my concern for who we can fight that against. Okay. Thank you. And there's some other issues here. The farming right now is obviously under a lot of pressure. We're a farming area. In fact, farming is actually the #1 industry in New York State, about $50 billion, believe it or not. Farming has been under a lot of pressure for a number of reasons. There's been regulations. We passed some really bad regulations this year that really impede the ability for our farmers to make a living, make a profit. And meantime, we're dangling money in front of them with these renewable energy projects that are all publicly subsidized. And it's taking away good farmland, and it's reducing the amount of farm products that are going to be produced in New York State. And in the end, we're going to have to rely on other states and other countries for our food. And that's not the New York State that we should have. We have a strong farming community. We should be delivering those goods and services here in New York State, because we have the ability to do this. We have around 20 million acres of farmland in New York State. And it's shrinking, but that's how much we have. And we saw during the pandemic how fragile our food supply chain is. And we saw farmers dumping milk and letting their crops rot in the field while we had nothing on our store shelves. And we had food pantries that went without food. People that stood in line for hours and then couldn't get the food they needed for their family during this pandemic. And it happened all across the state. So I'm very proud that I was able to craft a bill. We had the Nourish New York program, which was a good program that was created by our Ag and Markets, and we were able to craft a bill, a bipartisan bill, to make that program permanent and recurring in New York State to support our farmers and to support those with food insecurity issues. And a permanent recurring program is important because now farmers can plan for it, and those who provide food to others can budget for it. And so now this program has passed unanimously in both the Senate and the Assembly, and I'm proud to say it was the first Republican primary sponsored bill to pass in the Senate, and I'm glad to go with it. And now we're waiting on Governor Hochul to sign it, because unfortunately Governor Cuomo had no intention of signing it, I can tell you that. How do you know he didn't wear lipstick? All right, so I got one of these. So we're gonna start with questions, and I'm gonna turn it back to. This is my chief of staff, Allison Hunt, everybody.
I know there are a lot of questions here tonight, and I know that it might be hard to hear people in the back. So just logistically, if you are afraid you're in the back and that they're not going to be able to hear your question up here, you are welcome to come stand up here to wait for your question to be asked if you're in the front and you think your voice can be heard. But if you don't think your voice will be heard by the folks up here, please make your way up to the front. Not everybody all at once, but if you do have a question, you're welcome to come to the front to ask it. And George will be repeating all the questions so the entire audience can hear. So we're just going to try to keep this orderly. He's going to work his way around the room. So if there's multiple people in one section, you might not all get to ask your question. We might move on to maybe somebody in the back. So we'll just get, who's got a question?
Oh. Yeah. All right, can everybody see these? These are some ruby slippers, I guess. High heels. Okay. What's your question, ma'am?
Okay, a couple of questions, actually, and I'm going to try to tie them all in. What do you know about the secrets that Hollywood knows implanted in movies when they say there's no place like home? And Glenda says, you've had the power all along. And Star Wars says, the force is within you, and that we individually have the power within us to heal anything in our bodies. I know it because I did it. Lyme disease, 4.5 years, a heart attack, and a stroke, all here in Chautauqua County. This is the story. This here that I just published last week can tell you how I healed all that. How I also helped my mother. We've talked to you. My mother was brought to Pittsburgh Hospital in December. She manifested that, if any of you know anything about manifesting. And I got her out of ICU in 3 days when the doctors were trying to say that she had COVID. I do not believe in COVID. I believe in psychological warfare happening. I've got military family members that understand that. I got my mother out of ICU in 3 days by reprogramming the mind. You call it hypnosis. I can call it energy healing. The military would call it psyops, propaganda. Okay, and I told the doctor, I reprogrammed her mind overnight, and she woke up overnight. I got her out of there. I slept 13 days at McGee Hospital in Pittsburgh. My mom manifested another trip in January back to Buffalo Sisters Hospital. I snuck in because I'm an ordained minister also, and I said, you have a patient here who needs spiritual healing. So I went in and snuck into my mom's room. Again, she had COVID again, and I said, Mom, I know you don't believe in COVID. I don't believe in COVID either. Okay, that was the second time she was ventilated. Then she was ventilated a third time. The fourth time that my mom was put on a ventilator, paramedics went to a nursing home in Dunkirk where she was found unresponsive. 8 minutes down the road to Brooks Hospital, she was brought. I have all the medical records from the nursing home, the paramedics, and Brooks Hospital. My mother arrived at 93 degrees temperature. Would you, as a paramedic, ventilate a body unresponsive, dead? at 93 degrees. And then continue to put medicine in her for 2 more days. Until Tuesday, I'm standing in the parking lot and they're asking me to leave, and I'm calling 911 to get the police there and say, I need to see my mother because I just need to talk to her. When they finally let us in, because we agreed that we would remove life support, even though I knew she was already dead. We agreed. And when my brother arrived Wednesday morning, we went in Wednesday.
And you couldn't save her?
Let me back up. Tuesday, they let me in. First time in a year and a half I ever wore a mask. First time was when I went into that ICU room and I found my mother's dead body.
I thought you could save her.
2 days. 2 days. She was brought in Sunday night at 6:30. You can call Brooks Hospital. Francis Mongitori. So,
Yes.
my question is, how may I help you, not just to reduce the mask mandates, but to expose this whole live pandemic, and to bring criminal charges against the hospitals and the paramedics who ventilated a dead body at 93 degrees.
For corona, I have polyarthropathy and muscular dystrophy. I've had 3 forms of corona. They're autoimmune diseases, and I'm still alive.
Yeah.
Well, God bless you. I'm sorry what happened to your mother. You know, and all I can say is that you continue to have the faith that you have, and certainly we're in our jobs here. Our role here is to try to ensure that things like this don't get swept under the rug. I mean, this is the democracy dies in darkness, and we need to continue. And I'm sorry about your mother. And, I'm sorry that but you worked hard, and I'm just sorry that she's passed. I lost my mother in April last year. It's a tough thing to do.
My mother died of cardiac arrest, and she was found with hypothermia at 93 degrees, yet they ventilated her and drugged her for 3 more days.
All right, man, I'm sorry, but God bless you and your family. So, can we have, yes, thank you. All right, wait, we want to go in the back?
Gentleman over the
All right, way in the back there. Standing up, yes. The Under Armour hat on.
So, I've got 2 boys in elementary school, and schools have been in session for 3 weeks. And between the 2 of them, they've missed 10 days of school. And it's because when there's a contact in the school, they automatically quarantine the kids, send them home for 10 days. That's what we did in the early part of the pandemic. We did all the end of the 1 school year, then all the rest of the school year. Now we're into a 3rd school year, and we've started to become an outlier in the developed world and even amongst U.S. states with our aggressive quarantining and contact tracing of children. They're missing a lot of school. There was no plan in place to do remote learning this year because everybody thought the pandemic was over. And even amongst blue states, they are moving to a scientifically proven test-to-stay model instead of the quarantine model. It's been validated by a large-scale study in the UK that it proves it's the same outcome in terms of COVID spread in schools, but it's far less disruptive to the students. What are you doing, if anything, to address this crisis that we're inflicting on the next generation and the impacts are going to be felt for a whole generation?
I'm going to let PJ say something. I just want to answer your question here. Obviously there's a number of things going on. The bottom line is New York State was not prepared for what they did. That's why we had this knee-jerk reaction. These questionable Department of Health edicts that honestly did not follow the rules. That was the basis of my lawsuit. Was that they did not follow their own rules when they instituted these mandates. And so what we're doing is we're pushing back against that. We do have to be concerned. We have a constitutional obligation. The New York State Constitution states that they have to be responsible, the state government is responsible for the education of those children. The fact that they're not getting educated is a violation of the New York State Constitution.
So to touch base on that, really to step back, I'm not, my R's aren't brown for any other reason, that's what I was given. I spent 25 years as an educator. I've got my degree as an administrator as well. And one of the things, as the senator said, and I apologize if I just call them George or Andy, because we've worked side by side throughout this entire event. So our friendship is extensive. To your point, Christine Schuyler sent out a letter today to superintendents questioning and a process we're looking for. We are pushing, one of the other statements we're bringing to the governor is a passive investigation. Years ago, those people from the Falconer district, Patrick Morales died of meningitis. Patrick and I shared a slice of pizza that day. They called me up and said, you were exposed to somebody with meningitis, you need to get your medication, watch for signs and symptoms. We believe, when I say we, we're looking at our medical team, there's 7 of us, and we all agreed, 3 doctors, myself, the sheriff, Christine Schuyler, and Noel Gutman, our emergency services coordinator. We all agreed that we are not going to quarantine and isolate ourselves out of this. It's not working. The system needs to change. The point that I brought up, and I'll continue to bring up to the governor, what is our strategy? What are our goals? We knew what they were in March of 2020. As a coach for many, many years, we're in the second half and the game isn't over. They lost the court. What are we going to do? We need a plan and we need a system that works, utilizing experts, utilizing things that make sense. So we are asking the governor to change this quarantining piece, because right now, quite frankly, we are calling people, they're not picking up the phone. So when we call and say, have you been vaccinated? You look at our statistics, over 55% of our positive been vaccinated, 27% or higher unknown people aren't answering the phone. People, I understand, are sick of it. So we are going to pressure the governor to go back, going back and focusing on better ways, a passive way to investigate the disease, but not quarantining and isolating. And George is right. The schools are required by law to provide for the education if a student is there. Isn't there? Okay, so again, we need to hold that to them.
I just had a quick comment. I don't care how good your teachers are or how good the students are. You can't learn when you're not in school or interacting with a teacher or with a parent who's filling that role.
That's right. That's right.
And one of the most frustrating aspects, as you point out, is that every time they make a rule without considering the consequences, we end up with consequences that are worse than what the rule was designed to address. So, when the state issues an edict that says a healthcare facility must fire every employee that isn't vaccinated, that's ridiculous! They need to consider the fact that there's a shortage of staff to begin with. And when you and I and our friends and relatives go to the hospital or need the help of a nursing home, we sure as heck hope that they have the right staffing level with the qualified people to make sure that our issue is addressed. And it's not just about COVID. It's about heart attacks. It's about strokes. It's about knee surgeries, shoulder surgeries. It's about your mom and my mom and everyone else. We need to take the broad view and not be narrow-minded.
That's right.
We're going next. Yes, ma'am.
I just wanted to add to it, when my kids go to Fruitburg, my neighbor has been, we've been in school, what, 2.5 weeks? 20 days he's going to be out because he got exposed on the school bus riding to school, and then from his cross-country team. My daughter we pulled her off the swim team for the same reason. If you're on that bus, whether masked or not, they won't take you out. When my friend called, they got her tracer call, answered like a good citizen, she said, we were at the swimming, they weren't even near each other, and they were still told, I don't care, you weren't vaccinated, you stay home 10 days. That's how
Are you politicians aware of the fact that the CDC and the Department of Health will state that that COVID vaccine does not protect anybody against that virus? I have a recording on my phone.
All right. Thank you. We're going to go on to this guy here.
I'm listening to a lot of people here, and I'm really confused about confused
Here, here,
about.
You want to use the microphone,
I
sir?
am pro-life. I am against abortion. Okay? But why isn't wearing a mask and getting a vaccine pro-life issue?
Well, hold on. Sir, you addressed the questions to me.
All right, sure.
All right, what's your question?
My question is, why isn't getting a vaccine and wearing a mask a pro-life issue?
Okay, I'm going to answer your question. Okay?
It's graphene, it'll help.
First of all, being pro-life doesn't mean we're against the Constitution of the United States. That's number one. Okay? And what the people that aren't pro-life, what is their mantra? My body, my choice.
Exactly what you're saying about vaccination.
With that said, your answer to your question is you're pro-life. The bottom line is we are in a situation where people are dying because they're not getting the medical attention they need. We're going to have that right now.
Right,
it's not pro-life. It's
You're
not
not
pro-life.
vaccinated.
It's not. No, that's not to the truth.
Bullshit, and you know it.
Keep it clean. Come on.
You know it.
You want someone to walk in right now into a hospital where they're already short-staffed and say,
Why
I'm
are
sorry
they
that I can't treat you
short-staffed?
for your heart attack,
Why
but
are
thank
they-
God we're going to keep you safe from COVID.
Why
That's
are
not
they-
the right answer.
Why are they short-staffed?
All right, so one more question. We're gonna give him a 3-for-1 here tonight. So go ahead.
Why do soldiers get the Medal of Honor for saving a life?
Thank God for our Medal of Honor winners. That's for sure, because we wouldn't be having.
Why would we want to save a life?
Let's
Why wouldn't we want to save a life?
If I may, just a couple observations. First, as we all know, the vaccine is a shot, and it's helpful in mitigating the impacts and reducing the death rate according to some.
Let him finish this. Let me finish.
But as pointed out, it doesn't mean you won't get COVID, and it doesn't mean that you won't spread it. And in Chicago County, about around 19% of the COVID cases are those who have been vaccinated. So, what we do know for an absolute fact, is that if you don't have COVID, you won't spread it. So when it comes to our teachers, we have said, you can test out. So if you take the test and you don't have COVID, you can come in.
Measles, mumps, and rubella has basically been
So my
stamped
point
out
is
years
this.
from vaccines, and COVID doesn't protect you being a vaccine, so how does that work?
So my point is this. If we're looking at the whole picture and we want to maximize healthcare, we ought to allow those who have already had COVID and have natural immunity, we ought to let them work. We ought to let those who test clean without COVID, we ought to let them work. We ought to let everyone who has back office operations, who's working from home, we ought to let them work.
What if you're asymptomatic?
And so, the mandate that we have.
What does that help the next generation?
Oh, and one last comment, and then there's a lot of opinions here, certainly. If you are absolutely confident that the virus will protect you, get the vaccine, or the vaccine will protect you, get the vaccine. Then you don't have to worry about somebody else's.
You know that vaccine
Andy, that's the golden rule.
All right, sir, you have a question right here. Yes, sir.
Yes, I do. And I would like to know, as far as the children are concerned, the vaccination is truly needed. Here's my reasoning.
It's a question.
Hold on, hear me out before you say yes or no. It's pretty well known that the children can get this and not even know it. Okay? A child is
Okay, I'll repeat this question. Hold on. All right, you got it.
a child is 3 times more likely to drown every summer, and almost 7 times more likely to die from cancer each year than have died from the coronavirus. Now, my question is, have they done a study to see if these children are carrying the natural antibodies? Because they may have been exposed to it, they're carrying the antibody, and they don't need the vaccine.
Well,
That would be natural and true herd immunity
so the
for our
question,
posterity.
Yeah, so the question is, are we testing children that have, for antibodies for natural immunity? And, the bottom line is that may or may not be happening. I can't answer that, but I will tell you this. We're not taking that into consideration, and that's wrong.
It's very wrong. That's not science.
My wife and I both had recovered from it. The bottom line is, when it comes to that, this is where you have people that are just not listening. They say we don't listen to science. The science is that if people have had COVID and recovered, and they choose to get the vaccine, there's a lot of evidence that 1 dose and not 2. We're talking about how the rest of the world needs this shot. And we are essentially saying we're going to waste them on people that already had COVID, and that's wrong. If that's their goal, they're screwing up their own goal right there.
Did you know that the airbags that were recalled, the Takata airbags?
Yeah.
There were 11 million of them in our country. 17 people died from faulty airbags. There was a failure in the product that resulted in a death.
Yep.
17 out of 11 million. Did you know that if 75% of the adults in this country are vaccinated and not one more death occurs, you're at roughly 1,000 deaths per 11 million? Because the product failed and resulted in the death?
I'm going to move on. We got a lot of people that ask some questions, but thank you very much for your question. Where are we going here? All right.
The green shirt there.
That's you. All right, we're talking about the big picture. Our founding fathers had a tyrant government fresh on their minds when they established and wrote the Constitution. They did not want a king. They crowned our Lord Jesus Christ. Amen. Amen. As our king. He is above any other man. Faulty man, whatever you want. I mean, we're all sinners. We fall short of being able to be a king. That's right. But we have today a tyrant government.
Do you have a question, or is that just a statement?
Well, I got all kinds of stuff.
All right. Well, let me say this.
Number one, okay.
Yeah. Let me say this. What I said at the beginning. We've created dictators. We've done that here, and unfortunately, under the auspices of this crisis, right? Circle back to the beginning of the pandemic. It was March 3rd, 2020. I was new as your state senator. We started the new session in January. I was barely 2 months in. And they called us in for an emergency session, threw this bill in front of us. Andy can tell you this. And this bill was tied to $41 million to fight the coronavirus. This is March 3rd of 2020. But along with it, with all these unprecedented new powers for our then governor, Andrew Cuomo. Unprecedented by no other governor in New York history. In fact, no other governor in the United States history would have the type of power that he was going to be granted if we passed this bill that night. But it was all tied up around money and the uncertainty and the fear of what was going to happen next. And I'm proud to say that night, I was one of only 4 senators that voted against that bill. Because, as Benjamin Franklin said it in many ways, but he said that those that would give up essential liberty for the perception of security end up with neither. And that's the truth.
the senator and I have also raised constitutional issues on a number of bills. And unfortunately, as you know, it takes time for someone to bring a lawsuit and work its way through the court system. And you're seeing the courts striking down multiple New York laws in just the last year. The number of cases that have struck down New York law as unconstitutional in the last 12 months is unprecedented. And I'll give you just two simple examples. You remember last Memorial Day, the governor said, you can go out on the beach in Long Island at 50%, but you can't have more than 10 people in church. And it doesn't matter how big the church is, or what social distancing, or what you do. And the U.S. Supreme Court struck that down.
Yes, but may I continue with what I'm trying to say?
Sure, we have a young lady here who's going to ask the next question, but just finish what you're, yeah.
Okay, my number one issue is forensic audits. Because if we don't have faith in our government, in our voting system, we don't have.
Yeah.
My other thing is Cattaraugus County went constitutional people. Let's push it. But it takes the people.
You want to talk about that? All right. I'm going to give these over to the county executive. Hold on to this.
A lot of those questions were raised. The template, actually the law came to myself and Sheriff Quattrone. We both asked it. Right now, that is being drafted. My hope is that there will be sponsorship. That has to come from our legislators. We do have legislators who are signing on. The hope is next month that will be voted on here in Chautauqua County. We've been discussing it. It's something we're moving. We're using the Cattaraugus County as our template to move forward.
All right, thank you, PJ. All right, you want to speak to the microphone?
From the back.
Yes.
Hi, I'm here representing the children. My name is Carrie Smart. I'm from Jamestown, New York, and we have 7 children, my husband and I. My oldest daughter is 18, and we sent her to college, and my youngest is 4. So, I have 5 children that are currently in school, and last year, they go to Chautauqua Christian Academy. Last year, it was parents' choice whether they wanted to be masked or not. They were to wear a mask in, then they could take it off at their seat, and then, put it back on on their way out to school. And we were hoping that we would get a similar, mandate or whatever this year, but however, we did not. They were forced to wear the mask. So my older kids that are in high school are okay with it, because they can kind of pull it down, sneak a breath here and there. However, my 2 youngest, I have a kindergartner and a 2nd grader, and they have missed more school because of having anxiety over this mask issue. Like, they are getting stomach aches in the morning, and they're like, why do we have to wear this mask? Like, they don't understand. They can't even pull it below their nose, or their teacher has to be a tyrant and say, put it over your nose, put it over your nose. They can't. When they're in gym class, they have to wear it. My kindergartner says this to me: Mom, I feel like I'm overheating, but I'm not overheating, but my head gets so hot and I can't breathe. I'm like, does that mean you're trying to tell me you feel like you're gonna pass out? So my question is, what are we need to, no, I guess it's a comment, but it leaves an open-ended question. We have kids that are struggling, especially young ones that can't, communicate effectively their emotions, and I'm afraid that we're actually doing more emotional harm. Okay, some people are very into wearing the mask. I'm not afraid of COVID. But I feel like, can we just be a little lenient? Because I have heard alternative studies, call it misinformation or not, but that kids have a 99.997% chance of recovery, and they go and not just like during cold and flu season, parents are able to determine whether a child is sick or not and keep them home. I just feel like I feel like our government has taken the choice of parents out of our hands and dictated something that I don't know what do I tell my kids? Like, I don't have any control over my children, and I don't like that feeling at all. So that's just my comment.
Carrie? Is it okay for me to say that was a smart comment?
Rhetorical question.
Carrie Smart, thank you. Look, the governor was not elected as king of all school boards. I was not elected on the school board. I was elected as a state legislator. We have school boards that are elected by the community that are focused on helping the kids in their school achieve the maximum benefit of their school experience. We should rely and trust on their good judgment to do what's right for their school district and not rely on the
You want to save a life?
All right.
You want to save a life?
Okay, we gotta go to the next one, yes.
This gentleman over here.
Okay, sir.
I feel a lot of people's pain not really knowing who really believe in this. And that's, I feel your pain is not knowing who to believe in this situation. So my question to official is, who do we actually believe when we feel like we've been misled by health officials and by regular government officials?
Well,
how do you know who is in the costume and who isn't?
Those are, and those. There's no easy answer to this. But let me tell you something. This has bothered me from the beginning. Our previous governor did irreparable damage in this situation. Okay, he was saying that first of all, he politicized this vaccine. He politicized this pandemic from the beginning. He said as late as September 24th of last year, I would never trust a vaccine from the Trump administration. And then he turned around and said, oh no, not only are we going to trust the same vaccine, then we're going to mandate that you have to have it. How is that doing this? How is that doing justice to people? How is that building confidence? He was a horrible, horrible politician, a horrible human being, and he created the damage. You want to know where the vaccine hesitancy started? It started with Andrew Cuomo. That's exactly where it started. And then, on top of that, he politicized everything else. We were supposed to have a FEMA vaccination clinic here in Chautauqua County, 16,000 doses, and he took it and moved it to the city of Buffalo. Now, whether you're for or against the vaccine, the point is, if he felt that that was the right thing to do, he politicized it, moved it to the city of Buffalo, and then restricted the people that could come there. That's the kind of guy Andrew Cuomo was, and I'm sure as hell glad he's gone. So. All right, where are we going next?
They want to speak together, so
they want to
yeah,
speak
come on.
together?
This is good.
All right, hang on.
Yeah. Well, we all got the same. I have a legit question though. I'm going to follow your rules and ask a question.
I just want to know how many of you are parents. How many of you are aware of the educators that are about to walk out the door?
Yep.
Okay. Just making it super clear, because I'm married to one, and I'm so proud of him because he loves his job, but he's going to stand up 100% for I'm also super proud that she's here.
And my question is, what is the state's plan on October 14th is the latest date I've heard that we're going to be required to swab ourselves or have, my new title is COVID manager.
That's what you're paying. That's what the tax dollars are going to. Yep. Right? Pull your kids out.
What is the state's plan when hundreds, because in just our local area, I'm hearing hundreds of people who are refusing testing, and so statewide could be thousands. What is the state going to do when teachers leave and we have no one to educate our children?
Education is
And that's a real question. And the bottom line is, they haven't actually planned for this. It's fire and then aim. And that's exactly what we've got right now. We don't know what's going to happen when the governor said she's going to bring in National Guard troops to replace our healthcare workers. Well, not a lot of people know this, but you may have a doctor that's in the National Guard that's already practicing at a hospital somewhere. Are we going to pull him from one hospital and move him to another?
But they're not mandated to vaccinate until 2022.
The bottom line is there is no plan. There is no answer.
Thank you for telling me
Yeah,
that. I
wish there was a better answer for you, but that is the case. So.
The plan is to get rid of the virus.
Sir, we gave you plenty of opportunity to speak. Really, we did.
I just have one question. I'm an educator, and a part of me feels guilty. Next week, I'm going to be asked to test, and I'm not doing it. I will refuse. Part of me feels very guilty because healthcare workers in this area are just asking to be tested. But my thing is, I can't give in to testing because where is it going to end? Now they're asking us to test, then they're going to come after us with these vaccines. Where does it end? Your 5 to 12-year-olds will be mandated. The bill exists. It already exists.
Well, thank you. So, I actually would like some questions.
Well, the question is, where does it end?
I know. All right, this guy right here is the checker. Right there. All right. That's true. Sorry, we can sit down.
There's no way to prove that you people.
We have a bouncer. You want to hear my best friend?
Why do you assume?
Shortly after I got hurt and sent home.
Come to the microphone.
My question for you is, I know Governor Cuomo did a lot of, shall we say, shady things when it came to the judicial system. One of those things, I've talked to your office, talked to an individual that works with the veterans, his name is Uncle George. I've talked to him about issues. Yes, sir. He's a great guy, sir.
I appreciate
it. Speaks nothing but the best of you, sir. And the work that you're doing. And I know that Governor Cuomo also passed a thing about the juveniles not really being charged unless they commit heinous crimes until they're 18 years of age. Well, there's not just a health pandemic in this state. There's a pandemic of a turf war going on between rival gangs. And they're using our youth in this war because there is no real penalties for these individuals unless they repeatedly make offenses, and even the police are crying out, seeking some kind of reform for this. My question is there something in the works to help this? Because I understand the children, but they still have to understand there's accountability for our actions.
That's right. So he's talking about the raise the age statute that was passed actually when I was still county executive, and essentially it says that 16 and 17-year-olds have to be essentially treated differently, and they have to go to family court. They can no longer be treated as adults. It's created a lot of problems and chaos, and what he has pointed out is absolutely true. It's pushed down the ages now where the gang members are actually recruiting kids to do violent things. You've seen it in our streets, in our big cities especially. It is a crisis. And again, this is the unintended consequence of these so-called judicial reform laws. They have made spike crime. And by the way, where is this crime occurring the most? It's occurring in poor communities, communities of color. The people that they claim to be speaking on behalf and doing this for, they are harming those folks more than anybody else. And that's the real tragedy here. And we are trying to reverse that. That is an absolute priority.
On a related matter, Senator Borrello and I are co-sponsoring legislation to reform the catch and release lack of bail, and the legislation that we are co-sponsoring would restore judicial discretion in setting bail, would allow judges to consider how dangerous the individual was, and how much of a danger they are to society in setting bail, and to make sure that nobody falls through the cracks simply because they can't pay bail. It also requires a regular review. And so we've taken the concerns that were raised on the original and looked at how the federal bail reform, which involves bail, has worked, and we've crafted legislation, and we hope that the Senate and the Assembly will consider that.
Thank you. All right. Yes, sir. You've been had your hand for a long time.
I'd like to know what you'd like to do, Mr. Senator, about our family court system. Parents have no voice when it comes to retrieving their children with our police officers because they tell them it's a family court issue. I currently have over 660 signatures in the support of the YWCA CEO that says that our community has had enough of it.
All right, and yeah, the family court system, I don't know if, unfortunately, that's not quite our area of expertise. However, I will say this.
I have a petition that states the fact that the citizens are behind modifying the law to make it so criminal contempt is used.
Yeah, so what I'm going to say to you is present that to our office. We will help advocate so that we can, because there are issues there, there's no doubt about it. Present it to our office. We have some people here. We'll help advocate so we can help address that issue.
That's what I'm here for.
Yeah, that's absolutely. There you go.
There you go, people.
Where we go next?
The gentleman in the white striped shirt that's been
Yes.
standing up raising his hand for like half an hour.
I'll try to be as quick as I can. I'm not going to take up most of the time.
Sure.
So I just want to make a quick statement, and that statement being, when somebody is given the vaccine, we've had like 200-something million Americans vaccinated in this country, right? Okay, when somebody is given the vaccine, there is literally no follow-up with any of these people to try to report side effects and yada yada yada. So any reporting is voluntary. Most people aren't even aware of it. So my father was vaccinated, and I asked him the other day, and I encourage all of you to ask the people that you know that are vaccinated, you know, in your free time or whatever, ask them if anybody even contacted them or if they were given any means of contacting anybody else to try to report side effects from the vaccination. Okay? Now, that being said, the question is, why isn't there a system in place? Why is there not a party that's responsible for reporting this stuff mandatorily? Because we have so many people vaccinated. Where's the data? Where's the data going?
They don't want to.
I have a friend of mine that was adversely affected by a vaccine. Well, we think by a vaccine. He was mandated by his department to receive the vaccination. He received the vaccination. The very next day, he had a heart attack. He was hospitalized. No, I'm not trying to be sensationalist. I'm saying he was hospitalized for 4 days. Okay. The person that was reviewing his case wrote a letter to his department saying that he is to be on light duty indefinitely. Okay. Now he's 32 years old.
Oh my God.
He's healthy. There's nothing wrong with the guy. Had no prior conditions, nothing. Okay?
That's exactly what we're talking about.
I'm saying, where did the data go? Why was his information not plastered into a database full of people that have similar reactions?
I don't have an answer for you that.
Can we make it possible for literally everyone to have their data reported so that we can see really the real numbers behind what happens when you get vaccinated? And if nothing happens, great. But I'm saying that it should be recorded, and the fact that the data isn't even being collected is alarming.
Right. Thank you for your comment. All right, hold on. I want to give one second. In the back there, Amy.
Good evening, gentlemen. Thank you for letting us come and vent and talk and all of what we have to share today. While I understand that you all work at the state level, my question really is to Mr. Wendell.
Oh, thank God.
Because while we're working at the state level to make things happen and deal with Hochul, what are we doing about masks? What are we doing about quarantines? What are we doing about vaccines in school? And what are we doing about testing? Because when we go back to, you're sick, I don't need to quarantine. You don't have to quarantine. Our children are affected by this. You've heard everybody say that. But that's my question. Can we manage this on a Chautauqua County level.
So, to answer your question, so we are pushing back to get the change in the quarantine and isolation. The team believes in that. I was demanded by superintendents to ask for a mask mandate. I did not. I will not demand a mask mandate for our kids. The position that's, you know, for what it's worth, the governor even said it in her latest press conference in Buffalo. My position has been, let this go back to the local health departments. I stand behind that and will continue to stand behind that. Christine Schuyler, my team has talked. I've got 3 doctors. I learned one thing after becoming county executive, know when to shut up. I rely on the strength of my medical team. I know enough not to talk. They have studies. I've got 2 brilliant gentlemen. That's what we listen to. I feel very confident. The state is not allowing us. So we will continue to push. Again, I'm going to be there on Tuesday. She'll hear my voice again. We need to put this back. You know, people have to remember, when this started, there was not a COVID case in Chautauqua County. When the state closed, unfortunately, we had no choice. We issued the state of emergency, and we followed through. The opening came from the 3 of us. You know, those plans that people had to file, businesses had to file to open, came 5 weeks before Governor Cuomo. We were doing that here in Chautauqua County. I feel confident in the abilities for us to do that. We're pushing. Christine Schuyler, our public health director, is on SHO. It's a group of healthcare professionals and health directors of health. We're all pushing the same thing. Give this back to the local administrators right now and let us be able to manage this. And the passage.
So just do it. Okay? If we do push back, do we have your support?
Pushback isn't how.
Like every district.
She's on school.
Push back as in, I'm sorry, my body, my choice.
I don't deny that. Every school district has them. The reason I was forced and the reason why they said it had to come from me, not every school is going to follow this. What are we supposed to do? You have superintendents that make those decisions. I was told, county executive, you don't realize the difficult decisions we have to make as a superintendent. Wow. I guess I don't. I'll take that and say, okay, you got me beat. The difference between many of them and me is 9 credits. They took 9 more credits to be a superintendent. So with that said, again, the fight you're getting from the administrators, a lot. I can't speak for all of them, but I know I listen to people across the state. Nobody. And bear with me, I'm just repeating what has been said. People don't want to be that school, okay? They don't want to be the first school that opens and a kid gets positive, gets sick, and dies. Again, people say different things. That is the biggest fear that many administrators have, okay? So again, the districts, that's up to districts to make their decisions. If they want to stand up, I support a decision if they want to stand up. That's up to the districts. You elect people to make those decisions. And I can go back to the governor and say, hey, again, I'm writing things down. I have no problem opening my mouth in front of either governor. And we'll continue. I've got school districts that want to open. Give them the power. Let them get back to normal. And let's get through this.
Right on. Thank you, BJ. All right, we got one over here. Okay.
Hi, my name is Carrie. I want to thank you for staying late for us. I know this is yes, I can hear you. I know there's a lot of high emotions going on right now, and thank you again for staying late and hearing us. I am a registered nurse, and I am currently employed, but for how long, I don't know. And I am desperate because I advocate for my patients on a daily basis, and I do anything in my power to help them and advocate, and I have throughout this entire pandemic. Now, I am forced with a decision of something to put in my body that I do not agree with. If anybody else wants to get it, that is your prerogative, but now I'm going to lose my livelihood.
You don't need the vaccine.
I will still save a life, no matter my choices for my body. I will treat you whether you have COVID like I did this entire pandemic. I will treat you with whatever I'm going to lose my livelihood, and I can't get unemployment. What can I do? I have a lawyer. Mayor, I try to reach out to my employer, and I'm just so desperate. What can we do as our government to help?
It's gonna be too late.
Well, we actually introduced a bill, myself and Senator White, to ensure that you are able to get your benefits, and we're going to push. We have to have a special session. It's not right. It's absolutely not right. I mean, we allowed anybody for any reason at all to collect unemployment, and now to the people that worked through this pandemic, that everyone, all the uncertainty, you didn't know what was going to happen, and you were there every day, and now you don't get unemployment. That is absolutely wrong. And our governor should be ashamed of herself that she's doing that.
I think I won the trifecta. We've got our three leaders here. And this is a very important question. I'm steering away from the issues of the vaccine because next year is another election. It's a congressional election. So what I'm going to ask the three of you, are you considering running for the congressional seat? Because the redistricting is extremely important to this county and to the other counties. We're either going to be folded into Buffalo, and the person that you'll be voting for is a full-time Democrat. And now we have a situation of who is going to run on this seat. Is it going to be one of you? And I know I'm not asking a difficult question, but I hope it is. Because we can't rely on what's going to happen in Elmira to determine what's going to happen here. Your
Thank you, Doug. I am focused, believe it or not, I am focused on what I am doing now in the Assembly. And right now, I'm the Assembly floor leader for the minority, which means I coordinate all the debates on these bills. And I'm very thankful that I can represent you in that capacity on the floor of the Assembly. With regard to the redistricting, there are currently 2 maps out. One map takes our district north and south, and the first map, we don't join with Buffalo, we just join with everything around it, including all the way up Niagara Falls, Lockport, and all that area. The second map has our district going east and west, and it would include what we have always traditionally viewed as the southern tier, and it extends it further east to pick up parts of Binghamton. I personally support the southern tier, and hope that at the end of the day, our district continues essentially intact along the southern tier. But there are 2 competing maps, and we'll have to see what happens.
Thank you, Andy.
First of all, honored, and Doug asked a question, and I guess take a minute or two. When this first happened, Channel 2, 4, and 7 called and said, "You're on the short list. What are you going to do?" Thank you again. I'm honored. It would be 3 consecutive years of campaigning if you talk to my wife. I think over her dead body would happen. Having said that, I feel honored that people would even consider that I could do this, so thank you. Secondly, I have been a strong advocate, as Andy said, to keeping our district in the southern tier. Here's why. 10 years when we were under Brian Higgins, we received $95 million. In 10 years, $95 million. That might seem like a lot. Tom Reed has secured $145 million for Chautauqua County in that time. Why I feel it's important, 1, agriculturally, 2, the people that live here, Cattaraugus, Chautauqua, Allegheny, very similar in economic development, but we're the jewel. People don't realize this, and Allison can tell you as a former staffer for the congressman, Chautauqua County is the prize. If you win Chautauqua County, you win this district. And that's what I think is most important. Because if we get stuck with Buffalo, we're just going to be another name in the crowd. Great working relationship with Niagara County, but that's not us. We do not have the same concepts, we do not have the same concerns, we do not have the same problems as Niagara Falls or anybody up there along the Ontario border. We belong with the Southern Tier. I was on record stating that's what I support. Again, I still would fight for that as many times as it comes up. I will continue to push for that. There are those who think that have been speaking very strongly we should be with Buffalo. I don't agree with that. Not at all.
Thank you. Yeah, I'm going to say the same thing. I think one of the best things about the Southern Tier District, and I know we want to move on, but you have they're all a part of 11 counties, I believe, that make up this congressional district currently. There is no major metropolitan area that sucks all the attention away. You know, we're basically all equal throughout, and we share a lot of the same concerns, the same challenges. The fact that we border the state of Pennsylvania, which in the end is one of the biggest challenges we face, right? People can jump across the border, bring their businesses across the border, and that's a challenge unique to this area. I don't want to see us lumped in with Buffalo, you know, I mean, Brian Higgins was a nice enough guy, but when he was here, I mean, the guy couldn't find Chautauqua County with a GPS and a Sherpa. He never knew I mean, he was never here. So we can't go back to that. His voting base was in the city of Buffalo. We don't want to go back to that. As far, I don't know what the district's going to look like, but if it remains like it is, and I love what I do here in the Senate, but if the people would like me to consider that, I would certainly consider it if it stays in the same place.
And for the record, I think Senator Borrello or County Executive P.J. Wendell would do a phenomenal job for us.
So not you, Andy. All right. Hold on. Actually, let me wait for a while. Sorry.
All right, well, I'm only going to take as long as this guy did here. So I'm a tenured teacher. I've been in education for many years, many years. And I'm here tonight. It'll probably be my last night speaking in front of a group like this, because I'm probably not going to be an educator as of tomorrow for what I'm going to say, and that's okay. I'm just going to tell you guys, as a history teacher, there's a lot bigger thing going on here that a lot of people are not paying attention to. Number one, no offense to any of you guys up here, but if you trust your government, your history teacher did not do their job. And I love these three, I will say that. But Kathy Hochul, the way that she talked on Sunday, did you guys hear that? Saying, I need you to be my apostles. She thinks she's a god. She needs to go. You don't talk to people and tell them to go be your apostles. That is Jesus' job. That is not your job, honey. That is creepy. And if that didn't put chills up your spines, I don't know what will, folks. So I'm just going to tell you, schools are actually the training ground for a lot of the agenda that the government is pushing on the children.
Yes.
And I'm not going to be a part of it anymore.
Yes.
Hey, the door's right there, buddy. They asked if we had a bouncer. I'll do that job. So let me just say, I was investigated last year by the school after having 0 disciplinary issues for my entire life. I was investigating because I was talking to the kids about China and the things that they're doing and how they're banning things from the internet that they don't want people to see. Sound familiar?
Yes.
So I told the kids only facts. I told them general knowledge. The simplest thing, like, oh, that Xi Jinping has banned the image of Winnie the Pooh because people have made the reference that he looks like him. So I was actually walked out of my school. I was told to give up my name badge, treated like a pedophile, actually. I was told not to talk to any staff members, don't talk to anyone affiliated with the school. I had no clue actually what I had done other than kind of my job as a history teacher.
Communism.
So they told me don't talk to anybody. The next day they took my colleagues' cell phones and took pictures on their personal phones, my messages with my friends about what was going on with me, and they used those in the investigation against me. Personal cell phones. So I was brought up on formal charges of being a racist, and I was investigated, and I was let off of it. And I was walked back into my classroom and told I could still have my job the next day, only to shortly after be told that I am now being investigated for my vaccine stance because I told the children that it's a decision that they should make with their parents and with their doctors, and that their teachers should not be the ones telling them what to do.
education next Tuesday, if anybody's free that day.
What school?
Probably shouldn't say.
I shouldn't say that, I guess. But so I'm going to have this investigation, and I'd love for it to be made public. And I guess that's what my request is tonight. It should be made public what they're doing to me, because this is a bigger issue. This is a bigger issue. So I want to know, where is freedom of speech? Has it died? Has it died? Because they can walk around, other teachers, with shirts on that say vaccinated and just brainwash those kids. They can tell them to go get the COVID vaccine, but if you have one person who says that they should think about it, you're investigated.
I've been there.
And so I'm going to walk away because I'm done being bullied, I'm done being accused of things, and I'm done being dragged through the dirt. Tomorrow. The students were brought in and questioned about me, and my name was, of course, dragged through the dirt. They were brought in without parental consent, and they were questioned about me. So that should concern some parents, too, because the kids were minors. I'm tired of pushing masks on the kids. I'm tired of being a tyrant, because I don't actually think the masks work. I'm tired of the social distancing and telling the parents that all this stuff is happening in schools, and then there's homecoming and the kids are taking photos right next to each other, no masks on. We're lying to parents. I've had enough. So, what you guys need to look at here is you need to go out and you need to start studying this us versus them mentality that's happening in our country. And you need to look up the 9 steps to genocide, because honestly, we're at about stage 4. So my question is, how can you guys protect teachers when the nurses just got ran out of their jobs? So I'll be mandated out because I'm not going to take their test. And I'm going to have this investigation next week, which I'm probably not even going to attend.
What school?
To be honest with you. You can find me afterwards, we'll talk about it. But what you guys need to be aware of, I'll walk away, I'll quit my job, but there is a much bigger picture going on in this state and in this country, and people need to open their eyes.
Okay, thank you. I first want to say sorry, I'll make it quick. That vaccine site you must go to, it's called Bears Vaccine Adverse Reaction Site. You must go there if you know anybody that's had an adverse reaction, and be prepared to fill out a long form. Okay, I have 2 questions. I want you to ask Kathy that Kathleen wants to know, that we know that this vaccine is not going to eradicate anything, all right? It's a virus, it's just like the flu vaccine. I sure the heck hope it does help prevent people from getting seriously ill. I would never want anybody to get seriously ill over anything or prove me, right, prove me wrong with that. I hope it works. But since that's all it's intended to do, right, is to help somebody not get seriously ill, to me that's a treatment, correct? Yeah. All right. Since when can I not refuse a treatment, right? Okay, so they're allowing people to get religious exemption, quote, all right? And if Kathy Hochul says that God made the vaccine, she said that, all right? That's crazy, all right? God, all right. Then God, we should be allowed religious exemptions. Then why did my student get turned down religious exemption and now has to leave college, okay? And another student, they approved their religious exemption. So who's reading the religious exemptions? I mean, who's making the decision? So you can ask that too. Like,
this is a bunch of bull.
Bishop Kathy. Yeah, Bishop Kathy.
Yeah.
So no one has ever answered, please.
We will ask those questions on your behalf. Thank you for being here tonight. Thank you all.
I apologize, but I am the bearer of bad news. We are out of time, overtime. I apologize if we didn't get to your question, but Lisa Manstrom, raise your hand. Randy, raise your hand. They're going to be standing here by the door as you exit. If you have a question that wasn't answered or you have a constituent service matter, please talk to them and we will do everything we can to address your question. And George has a couple comments.
Real quick, there's a booth up front here. Andy Goodell's holding this booth. If you're interested in donating to the fire hall, they would certainly appreciate your contribution on the way out. Thank you all for being here tonight. I really appreciate it. Have a good evening.